My name is Arnau Velasco. I'm a biologist specializing in molecular analysis techniques applied to personalized cancer medicine. Today, I'm excited to share with you the results of our study, Concordance between mama typer and conventional immunohistochemistry in breast cancer, conducted using tumor samples from breast cancer patients in Lleida, Spain. Breast cancer is a heterogeneous disease characterized by distinct molecular subtypes, including luminal A, luminal B, HER2-enriched, and triple-negative. Accurate molecular subtyping is essential for determining prognosis and guiding treatment decisions. I would like to highlight the technical differences in analyzing receptor status. Immunohistochemistry detects the amount of protein expressed on the cell surface. Mama typer quantifies the level of mRNA in the cell cytoplasm, and fluorescent in situ hybridization uses fluorophores to visualize and analyze genes within the nucleus. The goals of this study were to evaluate the concordance between mama typer and immunohistochemistry and FISH in classifying breast cancer molecular subtypes, and to assess the potential of mama typer as a complementary tool to immunohistochemistry, particularly in cases where subjective interpretation or equivocal results present diagnostic challenges. The study design consisted in the retrospective analysis of breast cancer patients diagnosed at our center. Total sample size include 75 breast cancer patients. Techniques compare conventional immunohistochemistry for protein expression of estrogen receptor, progesterone receptor, HER2, and Ki67. FISH for amplification analysis of HER2 gene in equivocal cases. And mama typer for mRNA quantification of HER2, ER, PR, and Ki67. Outcome measures concordance rates assessed using kappa statistics for each parameter. The cohort consisted of 75 breast cancer tumors analyzed based on their HER2 status using immunohistochemical classification. 10% were HER2 1+ or negative, 82% were HER2 2+ or equivocal, and 8% were HER2 3+ or HER2 positive. Results obtained after analyzing estrogen receptor in a total of 74 cases by IHC and mama typer were positive agreement in 55 and 57 cases, negative agreement in 12 cases, and discordant in 5 cases. Results after analyzing progesterone receptor in a total of 73 cases were positive agreement in 29 cases, negative agreement in 21 cases, and discordant in 23 cases. Results after analyzing Ki67 in a total of 73 cases were positive agreement in 45, negative agreement in 5, and discordant in 23. The results after analyzing HER2 by FISH and mama typer in a total of 62 cases were positive agreement in 17 cases, negative agreement in 30, and discordant in 15. Concordance analysis resulted in an overall percentage agreement or accuracy of 93.24% for ER, 68.49% for PR, and 68.49% for Ki67. The positive percentage agreement or sensitivity was 95%, 58%, and 91.8%, while the negative percentage agreement specificity was 85.7%, 91.3%, and 20.8% for ER, PR, and KI, respectively. The expression values showed as a highly significant correlation with kappa values of 0.78, 0.4, and 0.15 for ER, PR, and Ki67. Out of 59 tumors classified as HER2 2+ by IHC, 26 were positive by mama typer, while 27 were positive by FISH. Comparison of HER2 expression levels measured by mama typer and FISH revealed an overall percentage agreement accuracy of 75.8%, with a sensitivity of 77.2% and a specificity of 75% The expression value showed as a highly significant correlation, and the agreement between the two methods was further supported by a kappa statistic of 0.49, indicating moderate concordance. The estrogen receptor concordance rate, reflected by a kappa statistic of 0.78, demonstrate substantial agreement, indicating high reliability for ER status determination. In contrast, the progesterone receptor kappa statistic of 0.4 suggests moderate concordance with compromised sensitivity, highlighting potential variability in PR assessment. The Ki67 kappa statistic of 0.15 indicates low concordance, underscoring challenges in reproducibility and standardization for this marker. The HER2 concordance rate of 0.49 reflects moderate concordance with moderate sensitivity and specificity values. The conclusion of this study: MammaTyper provides an objective and reproducible technique that complements IHC for breast cancer subtyping. The use of MammaTyper alongside IHC could improve diagnostic accuracy and guide personalized treatment strategies. While estrogen receptor status shows high concordance, significant discordance in PR, HER2, and Ki67 suggests the need for further validation. Future studies with larger cohorts are needed to confirm these findings and explore long-term clinical outcomes. I want to thank collaborators, institutions, and funding sources. Thank you.